Hello, my name is Melissa Sheldrick, and I became a patient safety advocate last year when we were made aware that our 8-year-old son Andrew died because of a medication error made at the pharmacy level. We did not find out this information until 4 months after he died. All we knew is that he went to bed one Saturday night in March and didn't wake the next morning. You cannot imagine the turmoil that we went through at that time. Andrew had a sleep disorder called parasomnia, and he was prescribed tryptophan daily, which worked incredibly well for him. The only problem was that it was in tablet form, which was too difficult for him to swallow at the tender age of 5 years old. When I asked the doctor about this, she recommended that we find a compounding pharmacy so that it could be made into a liquid. We found one close to home because we were told that the compound had a 2-week shelf life and it needed to be kept refrigerated. We refilled his prescription there for approximately 18 months until we picked up his last refill. When the coroner informed us of the cause of Andrew's death, he stated that it was a substitution error, that someone took the wrong medication off the shelf. He stated that there was in fact no tryptophan inside the bottle, that it was all baclofen, a powerful muscle relaxant, and that it had been mixed according to the tryptophan mixture. This amounted to 3 times the lethal dose of baclofen for an adult. Also, we later found out that the baclofen was for a topical mixture and not to be taken orally. Finally, we also discovered that the compound had been mixed by a student pharmacist and had not been adequately checked by the pharmacist on duty. So many errors. How would the pharmacy deal with them? What would happen next? The questions began in my mind, and so I started to research pharmacy errors. What I found was astounding, that in my home province of Ontario, as well as the rest of the country, excluding Nova Scotia, pharmacies were not required to tell anyone of the mistakes that were made. There is no learning that takes place when patients are harmed. This was unacceptable to me, and I needed to try and ensure that no family ever had to go through the pain and suffering, the PTSD, the heartache, and the anguish like our family did. Our little light was extinguished before it should have been. 1 year later, as I sit here, I'm proud of the progress that we have made. Saskatchewan, Ontario joined Nova Scotia in implementing permanent CQI programs. Manitoba has recently launched a pilot program, and it is their hope and mine that it will be phased in time. We have a promise from British Columbia, Alberta, New Brunswick, and Newfoundland to continue to look towards this program by presenting our story to committees and councils. PEI is discussing the program at their September council meeting, and I am awaiting communication with Quebec. I have also reached out to pharmacy professionals in the Yukon and the Northwest Territories. Had this program been in place prior to March of 2016, it is possible the gaps where the mistakes were made in our case would have been filled. It is possible that the tragic mistakes that led to Andrew's death would not have happened. It is possible the mistakes would have been caught before the bottle reached our home. In the time that I have been advocating for these changes in community pharmacies, I have heard far too many stories about mix-ups, dosage errors, and near misses. It is possible that some of these stories would not have happened. I've received messages through social media, and people have reached out to me to tell me their experiences with pharmaceutical errors. And I have realized that these errors are not random. They are not statistical anomalies. They are not made within an acceptable margin of error. They are common, everyday occurrences that are harming Canadians of all ages. These errors are avoidable and preventable, and we must work harder and have regulations and policies in place that reduce their number, frequencies, and severity. For me, the bottom line is that if these regulations had been in place, if there was a culture and a practice in community pharmacies of reporting errors, sharing best practices, and information on preventing errors, if there wasn't a culture of shame and blame, then maybe Andrew would be here with us today. The World Health Organization set out their Global Medication Challenge in March of this year. Their goal is to reduce medication errors globally by 50% in the next 5 years. Canada can play a significant role in this challenge, and I have made it my own goal to help do that. Undertaking the work of a patient safety advocate has helped me in my grieving process. Knowing that I am doing everything that I can to prevent harm to people and to hope that no one ever has to go through what my family has gone through gives me some peace. Our family does the best job that we can at getting through each and every day. Andrew had an incredibly caring spirit and was loved by everyone he met. It's his legacy that I'm building as I work to improve patient safety in this country. Thank you.